Migraine is a significantly impactful disease. I would not want to suffer from migraines, and I've known many people who've suffered from them, and it can be really disabling. So there's a significant diminishing of quality of life. People who have not only headache, but can have vision issues and balance issues and nausea. So there's a significant patient impact that we can begin to address.
One of the triggers that you deal with on migraine alone has to deal with stress, depression. Different emotional states can trigger and basically impact folks and bring on more migraines and then get into a spiral of migraines. As I look at my teachers, there was a study that came out a few years ago from Robert Wood Johnson that said 46% of teachers have a high level of daily stress. Mental health issues are profound. My teachers, by their basic nature, they're nurturers. They care about their kids. They carry that stuff home with them as they're caring about their kids. And so depression, stress, and anxiety are very real in their lives. And it becomes a compounding effect and helps actually pronounce and bring on more migraines and other issues. And so, yeah, it's a profound overlap. Then you asked about opioid abuse, which is every employer is concerned about that. There's been overuse of opioids. And, the narcotic and non-narcotic pain relief is one of the measures that people reach to. And it's our hope that we will decrease the opioid utilization in the treatment as there are more alternatives and better options for treatments today.
So because migraine can have such a disabling impact on physical health, it oftentimes also is seen that it has a significant impact on mental health, depression in particular. We have done some research looking at the prevalence of depression in people who have migraine, and studies have indicated that anywhere from 10 to 50%, depending on who's measuring and how they're measuring depression, suffer from 50% of migraineurs will suffer from depression. So there's a high prevalence of comorbid depression in the migraine population. That needs to be treated appropriately. It's not just then a question about how do I treat the migraine, it's a question of how am I also addressing the mental health need. In our research, we found that people who had migraine and comorbid depression had direct costs that were twice the cost of people who only had migraine. So people who had migraine had nearly double the cost of people who didn't have migraine. People who had comorbid depression and migraine had twice the cost of people with just migraine. So clearly, we have to be addressing both depression and migraine for the migraine population. Now, opioid use is another major behavioral health concern. We know that many migraine people are prescribed opioids, perhaps appropriately, perhaps inappropriately. In our research, we found that 30% of the people with migraine diagnosis also had at least one prescription for an opioid. That's of concern. A lot of people also were on benzodiazepines and concurrent opioids and benzodiazepines. That's of a lot of concern. So we need to be making sure that people who have migraine and have pain from migraine are having that pain appropriately managed. And opioids for most of those people is probably not the right answer. I think that people with migraine need to have assessment and treatment from an appropriate provider who understands what to look for regarding not only physical health, but also mental health, and knows how to manage pain and knows how to prescribe preventive drugs appropriately. The combination of migraine and depression can have a significant impact on quality of life. People who are pretty much disabled when they have a migraine flare-up and can engage in their usual social activities, physical activities. So there's a pronounced impact on quality of life that translates into a pronounced impact on medical utilization and cost.